beautiful people. It's me, Jazzy Mack, and I am calling all tired, overworked, and underpaid medical and essential workers. Okay, I know a lot of you have been saying, Jazzy, where are the remote medical jobs? Because I need to get somewhere and sit my tail down. Well, Jazzy has you covered. If you are an RN, LPN, you're a technician, or even if you're just someone that's looking for a good old customer service job that is work from home, that pays at least $25 an hour, this video is going to be for you. Some of these positions are going to be no phones, and some of them are going to be data entry, more research. Training is going to be provided for most of these, and equipment is always going to be provided as well. So before we get into the opportunities that we've got for places like Growth Therapy, CVS, and UnitedHealth Group, because y'all, that had y'all in a chokehold. Like at one point, y'all were legit in a chokehold, but that position's back. You know, I got to get into the shout outs super quick because a lot of people have been getting jobs and I'm proud of you all. So let's look at who got a job. So Miss Marshall said, update, I got the progressive position. Start date is June 8th with the highest pay for this role. Thank you, Jazzy. Congratulations to you, Marshall. We are so freaking proud of you. I'm so happy to hear this. And then Miss Karen said, thanks, Jazzy, for the interview tips you gave on the Starbucks episode. Those tips helped me land my job at an acute care facility as a nurse. God bless you and your family. Oh my gosh, God bless you because you save lives, okay? We'd be nothing without our nurses, our patient care technicians, all of those essential workers out there keeping us alive, keeping us safe. We would be nothing without you guys. And then Miss Crystalline said, hey, Jazzy, excited to tell you I got hired for a work from home job. Even though it wasn't one that you advertised, I used your tips and the resume kit and it paid off. I start my orientation Wednesday, May 31st. Thanks, Jazzy. You're the best. Next on my list is to tackle my credit. Congratulations to you, Miss Crystalline. So excited for you. And then Miss Leo said, came to say thank you. I got the Discover job. I applied as soon as this video came out and used your template and had 2 interviews and got the job. Great job. And thank you for the info. Congratulations to you. And then Miss Oleander Love said, hi, Jazzy, found your channel a few weeks ago. Thank you for your resume and cover letter templates. Didn't land the job that you advertised, but I did land my dream job with an offer for starting at $80,000. Your templates helped me structure my managing experience in a way that impressed the hiring managers. Listen, I am so excited. Y'all shouldn't just be waiting for these opportunities on YouTube. Take those resume templates and go apply in other places. Don't just wait on these jobs. Yes, I send out secret jobs as well, but don't just stop there, okay? Because there's a lot of opportunities out there. So I am so impressed. I'm so happy for you. $80,000 is a lot of freaking money for a work from home job. So I am so proud of you. And then I love this story because Billa Banks had applied for a job at Discover and basically didn't get the job. They said he didn't meet the requirements, came back. He stayed consistent, applied for other jobs on the channel, came back 2 days later and said, Jazzy, just received an offer from Toyota. Thanks. You're helping a lot of people. Many blessings. Listen, when you feel discouraged, you may be like, oh my goodness, nobody's like reaching out to me. Nobody's talking to me, but stay with it. Everything is timing. Everything has a season, okay? Maybe it's not your season. Maybe your season starts next week, okay? So stay with it. And if you need these resume templates, they are down below in the description box. If you go underneath the title of this video, you're going to see a little option that says more. Click on that option and right underneath that, you'll see the link to the resume template. So that's for all the people that are like, I can't find the templates. They're also going to be in the pinned comments. So let's go ahead and get back into it because y'all, we got some goodies today. So Growth Therapy, a bunch of you have heard of Growth Therapy. So we'll start, you know what? I actually want to start with a different company because CVS has a crazy amount of roles for people that, you know, have any type of medical background, right? And actually, you know what we're going to just go ahead and do Growth Therapy. Let me just show you the claim specialist job, because I know a lot of people are like, Jazzy, just show me something with no phones. Show me something that doesn't require me to have a whole bunch of experience. So this is going to be the first job that I actually want to show you. So growth therapy, you've all heard of it. It says we're looking for an experienced claim specialist who is passionate about improving mental health care landscape. This position will improve the billing operations. So you're going to be responsible for billing related to claim denials and resolutions. So essentially, you are going to be researching and finding solutions to denied claims. So if an insurance policy did not cover a claim, you want to basically see if there are options out there available where maybe it was just a clerical error, or it could have been perhaps the patient did not submit it for reimbursement. Whatever the case may be, you're going to be researching those things. So you may occasionally talk to an insurance carrier about a denial reason, but this isn't a phones position per se where you've got customers calling in. Your bulk of your work is going to be looking at errors, looking at the data, and looking at the policy to see why something was ultimately denied. So this is going to start at a minimum of $23 per hour. Yes, that amount can go up if you've got any type of medical billing experience, you've got any type of healthcare experience. Obviously, that number is going to go up. But let me emphasize this, because a lot of you get caught up on the, I don't meet all the requirements. It says, if you don't meet every single requirement but are still interested in the job, please apply. Nobody checks every box, and growth therapy believes the perfect candidate is more than just a resume. If that wasn't confirmation for you to get this freaking resume and submit that thing, I don't know what is. A lot of you are doubting yourselves, and women do it mostly. Women do it a lot more than men. Women are like, if I don't meet every single requirement, then I'm not qualified. Honey, most mediocre men only meet about half of the qualifications, and they will apply for the job and they get the job because they're confident. That's what the name of this game is. Okay. So I need you to rewire your brain and start applying for things, even if you don't meet every box, because here's a job that tells you clearly it's not just all about what's on your resume. So yes, the resumes are done for you already. They've got flexible working hours, PTO. They go on a company-wide winter break. They get mental health mornings every week where they basically give them 2 hours to just meditate, which is so awesome. And they've got all these other perks. So that's going to be growth therapy. Okay. Apply for that. A lot of the times these jobs go quickly. So if I were you, I would not delay submitting my resumes. Okay. Now let's go ahead and hop back into the previous role that we were talking about with CVS. So CVS has so many different roles. If you literally just type in either nurse, or if you typed in pharmacy tech, they've got a million zillion roles. So this one is a utilization management nurse consultant. It is 100% remote. It can be done anywhere in the country. And the pay is going to go from a minimum of $29 per hour up to $60 per hour. So this could very well be a six-figure job for some of you nurses out there. You also get stock in the company. I want to emphasize to you all that I paid off almost $100,000 in student loans based on the stock, the employee stock purchase plan that I had with previous jobs. So stock is free money. Let's keep that in mind. So if you've got any type of acute experience as a registered nurse, this is going to be for you. You can be licensed in any state, okay, as long as it's active, current, and unrestricted. And this is going to be an 8 a.m. to 5 p.m. job. That's Pacific time. So this isn't a nights, it's not a weekends job. This is a, strictly weekday job. And they do say you need to be willing to get a California nursing license within 6 months of hire. So all you nursing people, you know how that works. Okay. So associate's degree is going to be required. If you don't have a BSN, it's preferred, but it's not a requirement. They just want you to, at a minimum, have an associate's degree. So you wonderful people out there that are ready to leave the physical nursing world behind and hop into something a little bit less strenuous, I think this is going to be perfect for you all. This is the utilization management nurse consultant. And this job does have the resume. And basically what they do is they assess, plan, coordinate, and monitor the healthcare services for different members of the clinic. So they kind of they might plan out what type of coverage a patient ultimately, needs to have to get certain procedures done, or they might facilitate the treatment that a patient needs to have. They might also do some consulting related to how many nurses are needed or how many staff members are needed to complete certain types of procedures. So it could be a mixture of all of those things. But again, this is a fully remote job and it's probably going to go quickly. So resumes are done for this. CVS also has other jobs out here like case managers. This one is for Arizona, but if you go to their website, they've actually got jobs that are fully remote. So I'm just using this one as an example. So they've got fully remote case manager jobs. A bunch of those are out there. And then for you pharmacy tech people, if you've ever worked in prior authorization, you've ever worked as a receptionist at a doctor's office or a dentist office, this is going to be great for you. This is basically where if someone's ordering some type of medication and maybe it's some type of narcotic or controlled substance, you essentially would be the one calling the doctor's office hey, just want to make sure that you approve this and that insurance is going to pay for this before we allow this patient to, process this prescription order. So this isn't going to require you to necessarily have extensive certifications or anything like that. They're just saying have some sort of healthcare experience or have customer service experience. Call center experience is a plus because you're going to be calling the medical providers. You're going to kind of be the middleman, basically, and have a high school diploma. So that job is going to pay up to $27 per hour based on your experience. Okay, so now some of the other roles that are out here are clinical counselors, okay? A lot of people have been commenting saying, Jazzy, I do social work. I deal with the elderly and I do care coordination for the elderly, things of that nature, or I deal with foster kids. Well, this is a clinical counselor role. They do have afternoon shifts, night shifts. They've got a bunch of EAP, but this job easily goes into six figures, okay, based on your experience. So EAP, I think it stands for Employee Assistance Program, which generally is they have those programs for people that work in the corporate world. They never want people in corporate to get super stressed out, which is kind of like an oxymoron. But the EAP counselors are there to help employees when they're having a really rough day, or if they want to seek therapy, or if they want to seek some type of support resources for if they're caring for a family member or, someone that's sick. So that's kind of what the EAP does. So basically it says you're going to be responsible for the provisioning of telephone-based consultation, counseling, and providing information to members. You may provide one-time or ongoing counseling and lifestyle management services. So you're not actually counseling people. You're kind of pointing them to counselors in their area or other clinical resources in their area. So it says you're kind of providing telephone triage. All my nurses out there, y'all know what triage is. Crisis intervention and related services. So again, easily go into six figures. If you've got that social work background, this is something that you need to hop on. So this UnitedHealth Group, the Optum role for the senior billing representative, this one had you guys in a chokehold the other day because their system was glitching. So it wasn't allowing people to basically apply for the job. So it's back. It's fixed. The requisition number is going to be 216-7239. Again, this is going to be for billing. So you're essentially going to be looking at billing claims to see if there are discrepancies and if the correct billing codes have been applied to people's invoices. So again, high school diploma, a little bit of customer service experience. That's kind of all they're looking for. They do employ in California, New York, and all those other states that a lot of people ask questions about. And the rate of pay is going to be $18 to $36 per hour based on your experience. Okay. Resumes are done for this already, but if you've never applied for UnitedHealth Group or Optum, they are a great place to work. You do get full benefits, and they do also provide you with training and with equipment. So you never have to provide your own laptop or anything like that. So this is available. Don't know how long it's going to be out there, but if I were you, I would hop on it. Okay. So what we also have is they've also got a clinical appeals specialist role. It is fully remote. You can work anywhere in the U.S. for this role as well, but this is also going to be similar to the claims denial sort of role that we talked about a few minutes ago. And if you've got any sort of medical coding experience, this is going to be great for you. The ICD-10, all my data entry, medical terminology, folks know what I'm talking about. So this is another role that you all definitely want to apply to. And this starts at $68,000 per year and goes up to $133,000 per year. So if you got that ICD-10 experience, medical terminology, listen, you need to upgrade your job. You know, don't sell yourself short. Whatever your shortcomings are, they will fill in the gaps and train you. Okay, it's that simple. So another job that I wanted to show you all is going to be for the company. I think this is pronounced Invitae. It's got a kind of funny name, but yeah, it's Invitae. They are a genetic testing company. So I can remember when I was pregnant, not long ago, I had to do a lot of genetic testing to make sure that it's kind of like an early prevention, like making sure that they checked any type of issues or illnesses or traits that came from other family members. They wanted to check the baby for it. So I remember doing genetic testing, but you can do genetic testing for all sorts of reasons. But this is a company that I'd never heard of, but when I researched it, I was like, oh, I'm familiar with them. I've used this company before. So the stuff that they have out here is going to be for a billing and appeals specialist. Again, looking at those rejections, those claim denials, and sending those appeals to insurance carriers to get payment for those. So pretty similar to what we just talked about. And their national pay range is going to go from $23 to $29 per hour. Yes, they do provide you some training. I don't know how much, but they do provide some training. And then there's a different billing phone specialist. This one, I think, is going to be a little bit less intense. This one's probably going to be more so talking directly to customers versus insurance companies. So this one is going to pay about $21 to $26 per hour. So still very good pay for a billing specialist role, right? So you all let me know if you ultimately apply for any of these jobs. Congratulations to everyone out there that has landed jobs. And I'm so happy that a lot of you have been converting from lurkism and you're actually speaking to me and you're talking to me and you're like telling me what types of jobs you want to see. Like, it never helps when you're just like basically out there just watching videos. Like, you want to be active and you want to take inspired action to manifest the things that you desire. And it starts with actually speaking those things out into the universe. So I wish all of you well. I hope you all stay happy, stay safe, stay beautiful. And let me know if you have any questions down below in the comments. Until the next time, folks, I will see you in the next video. Bye.